Hi, everyone. My name is Derek Matthews, and I'm an assistant professor in the Department of Health Behavior here at Gillings. My research interests can be broadly categorized into a couple of different areas. The first is in the domestic HIV/AIDS epidemic, and this is where I really focus on understanding and trying to interrupt those processes that are responsible for the extreme racial inequity in HIV infection among sexual minority men. So for example, not only are Black sex or Black same gender loving men more likely to be living with HIV, and the CDC actually estimates that um, about 1 in 2 Black same gender loving men can expect to become HIV positive in their lifetime, to give you a sense of what we're talking about. But that HIV positive and HIV negative Black same gender loving men are less likely to have access to treatment or pre exposure prophylaxis, respectively. So and kind of the other area you could categorize my work into, it's related, but distinct, is in non-infectious disease LGBTQ health. And this is where I really use existing data sources to document health inequities, with the real interest being in trying to understand how these are influenced by kind of state and national policies. I've been fortunate enough to partner with organizations like the Center for Black Equity, and locally, the LGBTQ Center of Durham in this work. In terms of teaching in the fall, I'm a co-instructor for the first research methods course in the health behavior PhD program. But in the spring, I teach the LGBTQ health course, which is open to master's and doctoral students across Gillings, and across campus, really. And in that class, I really try to expose students to a really wide breadth of considerations when we're talking about LGBTQ public health. And this is ranging from research methods to policy and politics, intervention development, and the need to really center intersectionality in all of this work. Thanks for taking the time to listen, and I hope for the opportunity to meet you all in the fall.